Do you wake up several times during the night to go to the bathroom? This is more common than it seems, especially among older adults. But the truth is that in many cases, this problem can be avoided with small changes in your daily routine. In today's video, you'll find out what you should stop doing right now to get back to peaceful nights without interruptions to urinate. Stay tuned until the end and see how you can improve your sleep quality in a simple and natural way. Waking up several times during the night to urinate is a reality that affects millions of people, especially those over the age of 60. This problem has a name, nocturia. It is the frequent need to get out of bed to urinate during sleep. Although many consider it a natural consequence of aging, the truth is that nocturia can be a sign of physiological changes, poor habits, or even silent diseases. And more than just a simple interruption in sleep, it profoundly compromises quality of life, interfering with physical recovery, mood, memory, and even the risk of nighttime falls. To understand why this happens, it is necessary to explore in more depth what changes in the body over the years and how these changes directly impact the functioning of the bladder and kidneys. As we age, the body undergoes a series of natural changes that affect various systems, including the urinary system. One of the main factors contributing to nocturia is a reduction in bladder capacity. A young person's bladder can store an average of 400 to 600 millimeters of urine before generating the urge to urinate. In older people, this capacity can decrease significantly, causing even small amounts of urine to trigger the urge to empty the bladder. In addition, there is a change in the pattern of urine production by the kidneys. During youth, the body tends to concentrate urine during the night, producing smaller volumes. With age, this mechanism becomes less efficient, and the kidneys begin to produce almost the same volume of urine at night as during the day. This increase in nighttime urine production, called nocturnal polyuria, is one of the main reasons for frequent trips to the bathroom during the night. Another important factor is related to hormonal changes. One of the hormones that regulate urine production is the antidiuretic hormone, known as ADH. It acts on the kidneys by reducing the amount of urine produced, especially at night. However, with advancing age, the body reduces the natural production of this hormone, which leads to an increase in the volume of urine at night. In other words, even if the elderly person does not drink more fluids than normal, their body starts to produce more urine during the night, as if it was still in full daytime mode. This hormonal imbalance is silent, but it has direct consequences on sleep quality, and over time affects other cognitive and physical functions of the body. In addition to natural physiological causes, chronic diseases also play a central role in this process. Conditions such as diabetes mellitus, high blood pressure, heart failure, and even sleep apnea can trigger or aggravate nocturia. In the case of diabetes, for example, when glucose levels are out of balance, the body tries to eliminate excess sugar through urine, thus increasing urinary frequency. Hypertension and heart problems are associated with a redistribution of body fluids when a person lies down, leading to the formation of more urine during the night. And sleep apnea, although often overlooked, stimulates the release of hormones that increase urine production. All of these conditions, often present at the same time in older people, contribute to a vicious cycle. Sleep is interrupted, the body does not rest properly, and chronic diseases worsen over time. There is also a little discussed but extremely relevant issue: the impact of medications. Many older adults use diuretics on a regular basis to treat high blood pressure or heart problems. These medications, as their name suggests, increase the elimination of fluids from the body. When taken at night, diuretics virtually guarantee multiple trips to the bathroom during the night. Even medications that are not direct diuretics can have side effects on the bladder, such as antidepressants, sedatives, and certain medications used to treat Parkinson's disease. Self-medication, or even failure to adjust the correct time to take medications, may be sabotaging the sleep of many older adults without them realizing it. Finally, it is impossible to ignore the psychological and behavioral component. As they age, many people develop anxiety about sleep and fear of incontinence. The mere thought of "I can't wet myself at night" can trigger an anticipatory need to go to the bathroom, even if the bladder is not yet full. This creates a conditioned behavior. The person wakes up in the middle of the night, even without urgency, just to make sure they don't have an accident. In addition, older adults tend to have lighter, more fragmented sleep. They spend less time in deep sleep, which makes any discomfort, even a slight feeling of a full bladder, a reason to wake up. It is a silent cycle where the body, mind, and habits interact in complex ways, creating a pattern of constant interruptions throughout the night. Given all this, it is clear that the urge to urinate at night among older adults is much more than a simple consequence of age. It is a reflection of a more sensitive body system, habits accumulated over time, and health issues that need to be recognized and addressed. However, the most important thing is that in many cases there is a way to intervene, and this intervention does not have to be drastic or involve medication. Small changes in lifestyle, fluid intake, diet, medication use, and nighttime routines can make a huge difference, and it is these practical and effective strategies that we will discuss in the next topic, because understanding the problem problem is only the first step. Real change happens when we know exactly what to stop doing to regain control over our nights. Many people believe that the urge to urinate during the night is something that just happens, with no apparent direct cause. But few realize that one of the most impactful factors in this process is fluid intake throughout the day, especially in the hours before bedtime. And it's not just about how much water you drink, but also the type of beverage, the time of day it is consumed, and even what you eat with it. In the case of older adults, this relationship becomes even more delicate. With advancing age, the body begins to function different. The kidneys filter less efficiently, the antidiuretic hormone is produced in smaller quantities, and the bladder loses some of its elasticity. This means that any excess fluid ingested, especially at night, has a much more direct and immediate impact on urine production. Therefore, understanding how fluid intake influences sleep is essential for those who want to reduce or even eliminate nighttime interruptions caused by the need to urinate. To begin with, it is important to note that it is not the total volume of fluids consumed throughout the day that most interferes with sleep, but rather the time at which they are consumed. Drinking 2 liters of water between breakfast and lunch, for example, rarely causes problems. This is because during the day, the metabolism is active, the body moves, sweats, and the kidneys have time to process fluids gradually. However, when most of this intake occurs in the late afternoon or early evening, the body is already slowing down. The kidneys continue to filter, but the body no longer has the same active elimination mechanisms. As a result, this excess fluid ends up accumulating and is released during the night, forcing the elderly to wake up several times to empty their bladder. That is why many experts recommend drastically reducing fluid intake after 6 or 7 p.m., especially for people who already have a history of nocturia. However, it is not just water. Many common beverages have a diuretic effect, meaning they stimulate the kidneys to produce more urine. Coffee is one of the biggest culprits in this regard, not only because of the caffeine that stimulates the nervous system, but also because of its direct effect on kidney function. Drinking a cup of coffee at night, even decaffeinated, can be enough to trigger a night of interrupted sleep. The same goes for teas, especially herbal teas such as hibiscus, horsetail, green tea, and black tea. These infusions are known for their natural diuretic effects, and although they are often recommended for their health benefits, they should be avoided at night by those who have difficulty urinating during sleep. Even hot milk, a drink traditionally associated with relaxation before bedtime, can contain lactose, which in sensitive individuals can increase bowel movements and in some cases cause increased urine production. Another little discussed but extremely relevant point is the effect of water-rich solid foods. Fruits such as watermelon, cantaloupe, pineapple, and oranges are largely composed of water. Eating a slice of watermelon at night, for example, can be equivalent to drinking a glass of water. In addition, foods high in salt and sugar increase thirst, causing people to drink more water to compensate, often without realizing it. This forms a subtle but dangerous cycle. The elderly person eats a very salty dinner, feels thirsty hours later, drinks water before bed, and then is repeatedly awakened during the night by the need to urinate. Breaking this cycle requires awareness and meal planning. Knowing how to choose what to eat and drink at dinner is essential to ensuring a restful night's sleep. In addition to food choices, there is also the behavioral aspect. Many people develop the habit of drinking fluids at night for comfort or for fear of dehydration. In the case of older adults, this fear is often reinforced by generic medical advice, such as drink plenty of water, without considering the appropriate time to do so. Of course, hydration is essential for the healthy functioning of the body, but it should be distributed throughout the day in a strategic manner. A good habit is to drink more water in the morning and early afternoon, gradually reducing consumption as the day progresses. For those who feel very thirsty at night, it is worth assessing whether this thirst is real or just a reflection of previous, poorly adjusted habits. In some cases, nighttime thirst may be related to mouth breathing, dry environments, or even side effects of medications. It is also worth reflecting on the importance of self-control and discipline when it comes to drinking times. A glass of water 15 minutes before bedtime may be enough to interrupt several hours of sleep. Therefore, the last liquid intake should ideally occur at least 1.5 hours before bedtime. This window allows the body to process the liquid, the bladder to empty before sleep, and the risk of interruptions to decrease significantly. In some cases, it is even possible to train the body to adapt to a new rhythm. With persistence and regularity, many people report being able to sleep through the night without having to get up to urinate, something that seemed impossible before adopting these simple but powerful changes. However, it is essential to understand that the relationship between fluids and sleep is not limited to timing and volume. There are nuances that involve a combination of habits, diet, metabolism, and even emotional aspects. Anxious people, for example, tend to drink more fluids as a way to relieve tension, and this is also reflected at night. Therefore, the next step is to look at other behaviors and everyday factors that may be contributing, often silently, to your bladder continuing to interrupt your rest, and understand how these small, often overlooked details of everyday life may be affecting your night more than you realize. Many people people don't realize that what they eat at night may be directly linked to frequent trips to the bathroom during the night. However, the relationship between diet and bladder function is real, profound, and often underestimated. Especially in older adults who already face natural changes in urinary function, the choice of what to put on the dinner plate can be decisive for the quality of sleep. The bladder, although a storage organ, is highly sensitive to chemical stimuli from digestion. Certain foods, when metabolized, release substances that irritate the bladder lining and increase its sensitivity. The result is an increased urge to urinate, even when the bladder is not yet full. And when this happens at night during sleep, the impact on health and well-being is immediate. One of the most aggressive food groups for the bladder is acidic foods, the most common being tomatoes, citrus fruits such as oranges, lemons, and pineapples, as well as industrial vinegar-based sauces. When digested, these items alter the pH of the urine and cause an inflammatory reaction in the bladder epithelium, especially in people with increased sensitivity. When this irritation occurs, the body responds with an urgent signal to empty the organ, even without any real physiological need. What many people interpret as a full bladder may simply be a reflection of this inflammatory process caused by common foods in the diet. In the case of tomatoes, for example, it is not only the fresh fruit that causes this effect, but also ready-made sauces, ketchup, tomato paste, and even soups that contain large amounts of the ingredient. When consumed at dinner, especially close to bedtime, these foods can be real sleep saboteurs. Another food group that has a major impact on the bladder is spicy and hot foods. Items such as black pepper, curry, paprika, excessive ginger, raw garlic, and hot sauces have the potential to activate nerve receptors located not only in the mouth and stomach, but also in parts of the urinary system. When spicy food reaches the digestive system, it stimulates the release of substances such as capsaicin, which in turn influences the autonomic nervous system. This system also controls the functioning of the bladder. In older adults whose neurological regulation is already naturally more sensitive, this stimulation can result in involuntary contractions of the bladder muscles, leading to a feeling of urinary urgency. It is important to note that this response can occur even if the person is accustomed to eating spicy foods during the day. At night, when the body is about to enter a state of rest, it becomes less tolerant to aggressive stimuli, and the bladder reacts excessively. In addition to acidity and spiciness, another critical factor is the high sodium content in ultra-processed foods, sausages, and canned foods. Sodium has the ability to interfere with the balance of body fluids, causing retention during the day and, paradoxically, excessive urinary release at night. This happens because when a person consumes too much salt, the body retains water to balance the concentration of sodium in the blood. However, when lying down, the redistribution of fluids in the body, especially in the lower limbs, causes the kidneys to filter more urine. In older adults, this process is even more pronounced due to decreased venous tone and the presence of edema in the ankles or legs. Thus, a dinner rich in processed meats such as ham, salami, sausage, or even instant soups and canned foods can be the invisible trigger for a night full of trips to the bathroom. Sodium also stimulates thirst, causing people to drink more fluids before bedtime without realizing it, perpetuating the cycle of nocturia. Another important aspect is refined sugars and fast-absorbing carbohydrates such as white pasta, sweets, desserts, and soft drinks. In addition to causing blood glucose spikes, which are already dangerous for people with diabetes or pre-diabetes, these foods stimulate increased kidney activity. When there is excess circulating glucose, the body tries to eliminate the excess sugar through urine, which naturally increases urine production. For older adults who eat a plate of pasta with tomato sauce and finish their meal with a piece of cake or a soft drink, the likelihood of interrupted sleep increases exponentially. Not to mention that nighttime glycemic spikes affect the production of melatonin, the sleep hormone, further worsening the quality of rest. It is also worth mentioning the role of caffeinated and alcoholic products, which are often discreetly present in dinner. Dark chocolate, coffee, ice cream, or even a dessert with liqueur can contain enough caffeine or alcohol to stimulate the urinary system and make it difficult to retain urine during the night. Caffeine, as already discussed, is a powerful diuretic and stimulant. Alcohol, in addition to being a diuretic, directly interferes with the release of the antidiuretic hormone, ADH, causing the kidneys to produce more urine than normal. Both impair sleep continuity and intensify the fragmentation of nighttime rest, aggravating insomnia and daytime fatigue. When we think about the causes of frequent urination during the night, we often focus only on physical or dietary aspects. However, there is an equally important and often overlooked area that involves nighttime behavioral habits. The way we spend the hours before bedtime has a direct impact not only on the quality of our rest, but also on the functioning of our urinary system. In older adults, this impact is even more pronounced as the body responds more sensitively to stimuli that would be easily ignored ignored in other stages of life. Small, seemingly harmless behaviors, such as watching television in bed, keeping the lights on, or even using your cell phone just before bedtime, can trigger a series of hormonal and neurological reactions that compromise sleep regulation and increase nighttime urination. Understanding these habits is essential to regaining more peaceful and restorative nights. One of the most harmful behaviors in this regard is the excessive use of electronic devices at night, especially in the hours before bedtime. Exposure to blue light emitted by cell phone screens, televisions, tablets, and computers directly interferes with the production of melatonin, the hormone that regulates the sleep cycle. When this production is inhibited, the brain understands that it is still daytime and keeps the body in a state of alert. This not only delays the onset of sleep, but also compromises its depth and continuity. And here comes a less obvious but extremely important factor. When sleep does not reach its deepest stages, the body remains in a state of physiological alertness, in which internal stimuli, such as a slight feeling of a full bladder, are quickly perceived as reasons to wake up. In other words, the same volume of urine that would be ignored until the next morning during deep sleep is perceived as urgent when the brain is alert, waking the person unnecessarily during the night. Another common habit that directly affects the body's balance is the habit of lying down immediately after dinner. When a person lies down immediately after a meal, the digestive process becomes slower and less efficient. This digestive delay can cause gastric discomfort, reflux, and a feeling of abdominal heaviness, making it difficult to fall asleep and increasing the level of bodily stress. This stress, in turn, activates the sympathetic nervous system, responsible for alert and fight or flight responses, and inhibits the parasympathetic system, which should dominate during rest. In addition, this activation of the nervous system stimulates the bladder and kidneys, contributing to increased urine production during the night. In older adults, who already have a less elastic bladder and reduced production of the antidiuretic hormone, any extra stimulus is enough to interrupt sleep and generate the need to urinate. Thus, the simple habit of eating dinner and going to bed right away, without allowing the body enough time to process the food, becomes a silent trigger for poor sleep. Another point that deserves special attention is the use of medications at night, especially diuretics, anxiolytics, antidepressants, and even some antihypertensive drugs. Diuretics, as their name suggests, increase urine production. When taken at night, they force the kidneys to remain active during sleep, which inevitably leads to nighttime urination. Unfortunately, many people take these medications without paying attention to the most appropriate times, often due to a lack of specific medical advice or for convenience. But the problem goes beyond diuretics. Medications that act on the central nervous system, such as anxiolytics and antidepressants, can alter bladder sensitivity and cause both urinary retention and urgency. Sedatives, although they induce sleep, can compromise the quality of REM sleep, resulting in light and fragmented sleep, during which any internal discomfort is quickly felt as an urge to wake up. This effect is even more pronounced in older people whose bodies already have a reduced capacity for self-regulation. The temperature and lighting of the environment also play a significant role in this context. Sleeping in very hot or poorly ventilated environments forces the body to work harder to maintain a stable internal temperature. This increases metabolism and consequently the need to eliminate fluids. The body sweats less at night, which means that excess fluids are mostly eliminated through urine. Similarly, prolonged exposure to artificial light in the bedroom, even if it is dim, confuses the biological clock and delays the release of hormones responsible for relaxation and the onset of deep sleep. All of this contributes to the urinary system remaining more active when it should be at rest. A dark, quiet room with a comfortable temperature is therefore a powerful ally in preventing nocturia, but it is often neglected in family routines. There is also a psychological aspect to nighttime habits. Anxiety, excessive mental stimulation before bedtime, the habit of mentally reviewing the day's problems or planning the next day while lying down, all of these activate the stress axis and prevent the body from entering a deep state of relaxation. When the mind is restless, the body responds with muscle tension, rapid heartbeat, and irregular breathing. And in this state of constant alertness, the body tends to interpret any internal stimulus as a sign of urgency, including a slightly full bladder. The fear of not being able to hold urine or losing control during sleep is also a recurring concern among older adults, which paradoxically increases the chance of waking up during the night. These thoughts condition the brain to wake up at intervals, creating a pattern of interrupted sleep that feeds back on itself night after night. Given all these factors, it is clear that nighttime habits have a huge impact on sleep quality and urinary system function. They form a web of small behaviors that, individually, may seem harmless, but when added together, have a significant physiological impact. The good news is that many of these habits can be adjusted relatively easily, as long as you are aware of them and willing to observe your routine more closely. However, just as important as correcting these behaviors is understanding how the way we sleep, our body posture, the type of mattress, and even the position of the bladder during rest also directly influence the urge to urinate urinate during the night. This is the next aspect that deserves special attention, as the body, even at rest, responds physically to the way it is positioned. And the simple act of choosing an inappropriate sleeping position may be the detail that is sabotaging your nights without you realizing it. When we talk about nighttime urinary frequency, we almost always focus on aspects such as diet, medications, or pre-existing conditions. However, there is a factor that is often overlooked and can be decisive for those seeking more peaceful nights: the position in which you sleep. It seems too simple to be relevant, but the truth is that body posture during sleep directly influences pressure on the bladder, fluid circulation in the body, kidney activity, and even the functioning of the nervous system. In older people whose physical structure has undergone several changes over time, such as loss of muscle mass, weakening of the pelvic floor, and changes in the spine, the way the body rests in bed can determine whether the bladder will remain calm or become overactive during the night. To understand this relationship, we must first look at the distribution of body fluids during sleep. Throughout the day, while we are standing or sitting, gravity tends to concentrate body fluids in the lower extremities, especially in the legs and ankles. This is why many people notice swelling in their legs at the end of the day. When we lie down, this distribution changes. The fluids that had accumulated in the legs begin to return to the general circulation and pass through the kidneys, which then increase urine production. This would explain in part why so many people feel the need to urinate shortly after lying down or in the early hours of the night. Now imagine how this situation is exacerbated if your sleeping position further promotes this fluid displacement or compresses organs such as the bladder or kidneys. The wrong position amplifies this redistribution and intensifies the signals the body sends to the brain to empty the bladder, even if it is not yet completely full. One of the most common and often problematic positions is sleeping on your back. This posture, known as supine, may seem comfortable at first glance, but it has important effects on the bladder and urinary system. When a person sleeps in this position, the weight of the abdominal organs rests directly on the bladder. In people with weakened pelvic muscles, common in the elderly, this constant pressure can cause premature urinary stimuli. In addition, the natural relaxation of the urinary sphincter during sleep can, in this context of abdominal pressure, induce a feeling of urgency or even small urinary losses, especially in those who already suffer from mild incontinence. More importantly, this position does not promote efficient lymphatic drainage or harmonious fluid redistribution, which can result in greater fluid retention in the tissues and consequently a greater volume of urine being produced in the early hours of the night. Sleeping on your side, especially on your left side, tends to be more beneficial for the functioning of the urinary system. This position promotes blood and lymphatic circulation, reduces pressure on the bladder, and improves kidney function. This is because the left kidney, although slightly higher than the right, tends to drain better when the body is positioned on the left side. This position also relieves compression of large blood vessels, such as the inferior vena cava, which optimizes circulation and prevents unnecessary fluid buildup in the tissues. For people with gastroesophageal reflux, another factor that disrupts sleep and can indirectly increase urinary frequency, sleeping on the left side also offers relief, reducing nighttime episodes of burning or abdominal discomfort. However, even in this position, which is considered ideal, it is necessary to pay attention to the quality of the mattress and pillow, as improper alignment of the spine or hips can cause pain and stiffness, which also fragments sleep and increases the perception of internal stimuli such as a slightly full bladder. Sleeping on your stomach, a position known as prone position, is one of the least recommended positions, especially for older adults. In addition to forcing the natural curvature of the spine and compromising breathing, this position directly presses the bladder against the mattress, creating an environment of constant discomfort. Although some people report feeling relaxed in this position, it can trigger involuntary contractions in the pelvic muscles, which in individuals with an overactive bladder can lead to early awakening due to a feeling of urinary urgency. In addition, this constant pressure can irritate the nerves around the bladder and urethra, intensifying sensitivity in the area during sleep. Another key factor related to sleeping position is the quality of support provided by the bed. A mattress that is too soft or conversely too firm can create pressure points on the body that compromise circulation and promote fluid retention. The ideal mattress allows for proper alignment of the spine, supports the body's natural curves, and distributes weight evenly. In addition, the use of strategically positioned pillows between the knees, for example, when sleeping on your side, can help stabilize posture and reduce tension in the pelvis, indirectly protecting the bladder. These details may seem small, but when added together, they make a significant difference in how the body reacts during the night. Finally, there is the issue of the environment surrounding the body. The way the bladder responds to stimuli is also influenced by body temperature, noise levels, and even the texture of the sheets. A cold environment, for example, causes peripheral vasoconstriction, causing the kidneys to filter more urine. In addition, cold activates the bladder reflex, stimulating bladder contraction. In sensitive people, just contact with cold sheets or a slight draft can be enough to trigger the urge to get up to urinate. urinate. Therefore, paying attention to temperature, wearing appropriate sleepwear, and using warm but breathable blankets are important allies in keeping the bladder calm during the night. The sum of these physical and sensory factors determines the body's state of relaxation, and this state is what will allow the urinary system to work at a resting pace rather than in a state of alert. By understanding that sleeping position is not just a matter of comfort, but a decision that directly influences the body's physiological functioning, it is possible to start making more conscious and strategic choices to improve sleep quality. And as we have seen so far, sleep and the urinary system are more connected than one might think. But in addition to physical posture, there are practices that can be incorporated into the nighttime routine to prepare the body and mind for deep rest. Light walks in the late afternoon, gentle stretching before bed, breathing techniques, and setting fixed times for going to bed and waking up. All of these behaviors make up what we call sleep hygiene. And it is precisely these practices that we will explore below, because lasting change only happens when you transform your internal and external environment at the same time. In the world of sleep health, few things are as underrated as the nighttime routine. For many people, especially the elderly, night is seen only as the end of the day, the time to lie down and sleep. But what comes before that, the choices, the gestures, the habits, the stimuli, profoundly shapes the way the body will rest. And in the case of nocturia, the frequent need to urinate during the night, the quality of sleep preparation can be a turning point between a restless night and a restorative night. The good news is that in most cases, there is no need to resort to medication or radical solutions. Small changes in daily behavior, when repeated regularly and intentionally, have the power to re-educate the body, improve urinary system function, and restore the natural sleep cycle. These practices are what we call healthy routines, and in the context of nocturia, they become powerful tools for transformation. The first and perhaps most important of these is establishing a regular sleep and wake-up schedule. The human body functions based on biological rhythms, such as the circadian cycle, which regulates not only sleep but also hormone production, digestion, body temperature, and of course, urine production. When these schedules become irregular, going to bed at 9 p.m. one day and 11:30 p.m. the next, waking up late or early with no pattern, the body loses its sense of predictability and becomes unbalanced. For the urinary system, this means confusion. The kidneys do not know when to reduce urine production, the bladder does not learn to hold urine for longer periods, and the brain interprets any sensation as a warning sign. Creating a nighttime ritual with consistent schedules teaches the body to slow down and respect rest time. This ritual can include turning off the lights, reducing noise, reading a light book, or practicing deep breathing. The important thing is not just what you do, but doing it intentionally and repeatedly. Another essential point is to include light physical activity in the late afternoon or early evening, such as a leisurely 20 to 30-minute walk, gentle stretching, or even relaxation exercises. Physical movement at this time of day has multiple benefits. It improves circulation, reduces fluid buildup in the legs, lowers cortisol, the stress hormone levels, and prepares the body for rest. For older adults, walking is especially beneficial because it activates venous return. That is, it facilitates the elimination of fluids during the day, reducing the amount that will be processed during the night. In addition, walking outdoors, if possible in the late afternoon, exposes the body to natural light, which helps regulate melatonin production at night. This simple habit can cause the kidneys to reduce their nighttime activity and enter their natural rest cycle, which directly contributes to a reduction in nighttime urination. Gradually reducing fluid intake in the hours before bedtime is also part of this smart routine. As mentioned in previous topics, it is not about dehydrating the body, but rather adjusting the pace of hydration throughout the day. Ideally, you should drink most of your water between morning and mid-afternoon, significantly reducing your intake after 6 p.m. However, this reduction must be accompanied by other precautions. For example, eliminating very salty foods at dinner is essential, as salt causes thirst. Similarly, avoiding diuretic teas, coffee, soft drinks, or juices high in sugar helps to avoid stimulating the bladder during rest hours. More than just cutting out liquids, it is important to get into the habit of emptying your bladder twice before going to bed. Once, shortly after starting your nighttime ritual, and again, immediately before going to bed. This simple strategy teaches your body to associate bed with an empty bladder, which significantly reduces nighttime urges to urinate. Within this logic, mental and emotional relaxation practices also come to the fore. Stress, anxiety, and racing thoughts are silent sleep saboteurs. Often, a person will physically empty their bladder, but their mind remains alert, interpreting any internal discomfort as a reason to wake up. Techniques such as diaphragmatic breathing, guided meditation, listening to soft nature sounds, or even silent prayer are resources that help the nervous system migrate from the sympathetic, alert state to the parasympathetic, rest state. When this internal button is pressed frequently, the body learns to respond less sensitively to mild stimuli, such as a small amount of urine in the bladder. This silent training of the mind and body results in greater physiological tolerance and deeper, uninterrupted sleep. Also worth noting is the organization of the physical environment where you sleep. A dark, quiet room with a comfortable temperature is more than a luxury. It is a necessity for the body to truly rest. In very hot environments, the body loses water through sweat and increases kidney activity. In environments that are too cold, blood vessels contract and bladder reflexes are activated. The ideal is a thermal balance with comfortable clothing, breathable blankets, and if necessary, the use of humidifiers or silent fans. Eliminating artificial lights, turning off electronic devices, and keeping cell phones away is also part of a healthy sleep routine. The bedroom should be perceived by the body as a place of complete rest, not as an extension of the living room, television, or mental activity. The more the environment resembles a sensory nest, the more the body relaxes, and the less active the bladder becomes. It is natural for the body to undergo changes over the years. Some are subtle and silent, others more obvious and uncomfortable. The urge to urinate at night, for example, is often attributed solely to age or daily habits. But this is not always the case. In many cases, nocturia can be the first sign that something deeper is happening in the body, and ignoring it can mean missing the chance to identify a health condition that requires medical attention. There is a fine line between what is considered normal aging and what may be a sign of a bigger problem. Therefore, observing your body, recognizing patterns, and above all, knowing when it is time to seek professional help is a form of self-care that is just as important as eating well or sleeping well. One of the first warning signs is a sudden increase in nighttime urination without any clear change in habits. If a person used to wake up once a night to urinate and within a matter of days or weeks starts getting up 2, 3, or more times, even while maintaining the same diet, hydration, and sleep routine, this pattern deserves attention. Sudden changes in urinary rhythm can be caused by urinary tract infections, hormonal disorders, kidney disease, or even neurological change. When the body loses control over its own rhythm, it signals that it is struggling to maintain balance. And the bladder, being a highly sensitive organ, is often one of the first to react. You don't have to feel pain for something to be wrong. A sudden change in pattern is reason enough to seek medical advice. Another symptom that should not be ignored is urinary urgency accompanied by pain, burning, or discomfort when urinating. Older adults often tend to normalize these signs, treating them as part of aging, but they are not. These symptoms may be associated with urinary tract infections, which, when recurrent, can cause serious complications, or inflammation of the bladder, such as interstitial cystitis. Burning when urinating, the feeling that the bladder never empties completely, or the presence of cloudy urine with a strong odor are not trivial details. They are clear signs of an infectious or inflammatory imbalance. If there is associated fever, lower back pain, or extreme fatigue, the condition may indicate a kidney infection, which requires immediate treatment. The sooner the problem is diagnosed, the simpler and more effective the intervention tends to be. In addition to infections, it is essential to be aware of the presence of blood in the urine, even in small amounts. Hematuria, the technical name for this symptom, can be caused by infections, kidney stones, trauma, or in more severe cases, tumors in the urinary tract. The blood does not always appear bright red. Sometimes the urine simply takes on a darker shade, turning brown or reddish. And since many elderly people take anticoagulant medications, there is a tendency to associate this discoloration with the effects of these drugs. However, no episode of blood in the urine should be ignored or treated with self-diagnosis. Simple tests, such as a urine test or ultrasound, can clarify the origin of the symptom and allow for early and effective treatment. Ignoring signs like these can be costly. Another less visible but equally important aspect is the relationship between nocturia and chronic diseases. In people with diabetes, for example, frequent urination, including during the night, can be one of the first signs that glucose levels are out of control. Excess sugar in the blood causes the body to try to eliminate this glucose through urine, increasing the volume of renal filtration. The same occurs with heart failure. During the day, the body can retain fluids in the legs, and at night, when lying down, these fluids return to the circulation and are eliminated by the kidneys in the early hours of the morning. This explains why many elderly people with heart problems wake up frequently to urinate shortly after going to bed. In cases of sleep apnea, another often overlooked problem, sleep fragmentation causes hormonal stimuli that increase nighttime urine production. In these situations, it is not enough to simply reduce fluid intake or change sleeping position. The underlying cause must be treated. There is also an often overlooked factor, neurological changes associated with aging. Diseases such as Parkinson's, Alzheimer's, multiple sclerosis, and other syndromes that affect the nervous system bathroom can compromise bladder control. Sometimes the loss of this control first manifests itself at night, when the brain is less alert and communication between the brain's command centers and the bladder becomes more fragile. When there is difficulty holding urine, a feeling of urgency for no apparent reason, or episodes of nighttime incontinence, further investigation is needed. An evaluation with a urologist or neurologist can reveal subtle but important causes for urinary symptoms. And the earlier these changes are detected, the greater the chances of preserving the patient's autonomy and quality of life. In addition to physical signs, there are also the emotional and functional impacts of nocturia that cannot be ignored. When an older adult becomes afraid to sleep because of the need to wake up several times to urinate, or when they begin to limit their water intake for fear of having an accident at night, the problem has gone beyond the limits of the bladder. It has begun to affect the person's safety, self-esteem, and peace of mind. Cases of nighttime falls while trying to go to the bathroom, anxiety before bedtime, and constant tiredness throughout the day are all indicative that nocturia is significantly impacting life. In such cases, seeking help is not only a sensible choice, but a gesture of protection for one's own dignity and well-being. For all these reasons, it is essential that nocturia be seen not as a simple consequence of aging, but as a symptom that deserves to be understood, investigated, and, when necessary, treated with professional support. Advances in medicine and geriatrics now offer numerous tools, from imaging tests and laboratory tests to behavioral therapies and modern medications that can significantly improve nocturnal urinary conditions. But the first step is always to recognize when the body is crying out for help, and it is precisely this attentive listening to the body that leads us to the next essential point, understanding that the path to more peaceful nights does not depend only on what we avoid, but also on what we consciously choose to incorporate into our daily lives. Actions, choices, postures, and attitudes that, when added together, build a life with more quality, security, and autonomy.